start off. Welcome back. It seems like it's been a while since we've done a podcast. I'm Dr. Bell, Dr. Terrezza, and we have with us Dr. Montgomery. So thank you for being here, and certainly we want to get into, I know the listeners, the viewers, and patients want to know a little bit about your background, but I hope everybody had a good holidays, good New Year, and it seems like things are rolling in January. Everybody's back in school, and everything's picking back up. But Dr. Montgomery, before we get into kind of what our podcast topic is, give us a little bit, where are you from? Where'd you go to school? Where are you practicing out? Give us a little bit.
Sure.
Yep.
I originally grew up in Chattanooga, Tennessee, and then I moved further south. I went to UAB School of Optometry in Birmingham. I graduated from there and then kept on going even further south and ended up on the eastern shore of Mobile Bay in Alabama. And I've been practicing there and in Mobile for about 14 years now.
Gotcha. And you're, as far as any interest, just general optometry, anything that kind of sways you or makes you more interested in something else?
Sure.
What do you think? Yeah.
I do like the everyday kind of optometry, seeing routine eye exams. That's great. I have a special place in my heart for the kiddos. I like working with the children. I also really enjoy last-minute problems. Foreign bodies in the eyes, injuries to the eyes. I like dealing with that and helping people out in a pinch. I also do a lot of disease. I like seeing and treating a lot of disease as well. So
she has quite a following in the pediatric area in Baldwin
Yeah,
County.
I can say that for sure.
I'll
And
say
where, if patients want to reach out to you and find you, where are you practicing at now as far as the locations?
Yeah, currently I'm practicing in both the Fairhope location and in the Foley location.
Okay. And so both those locations, TerrezzaOptical.com, you can Google it. Certainly, we've got openings, get you being seen, whether it's a full, complete exam or an office visit or whatever's going on, we can get you seeing Dr. Montgomery. But we appreciate you joining us today.
Yeah, thanks for having me.
Well, the big thing we do, and I remember when I first started with you, that was the one thing that you said we want to continue, and certainly as doctors with a heart. And I know some of that information is kind of already out, but we definitely want to do a podcast on it to discuss it. What is it? What does it entail? Who qualifies? What offices are on board, providers, that sort of thing. But I know it's dear to your heart. Give us a little bit how it got started and the history of it.
So we've been doing it 38 years, if you can believe that. And I hooked up with a dentist in Iowa, and he was a friend of President Reagan. He was well connected, and he did free dental and fixed what dentists do on this thing for no charge. And they had some MDs with it, and then they started with some optometrists in Washington, D.C., and they contacted me. I'm a member of the American Optometric Association. I volunteered, and anyone that comes in they get whatever they need. They have free eye exams, free glasses, free contacts, free drugs, free follow-up health visits. We don't just do it a one-time deal and you're done. If you have a serious problem, we'll stay with you. And that differentiates us from all the other problems that certainly get a lot more advertisement and certainly make a big splash when they come to town. Number two, we're here all the time. So that's why we're able to follow these patients with particular problems they have. And we've done very well with it, and I'm very happy. We have offices in our Fairhope office that will have this available. Call them for date and times. Well, the date is all the same. It's a Valentine's Day, Doctors with a Heart thing. So it's on that Friday before. Valentine's Day is on a Saturday. Right. We have it that Friday before. You ought to call now and get an appointment because they're going to go. And once we fill up, and we'll fill up Fairhope, we'll fill up Foley, we'll fill up downtown Pensacola opposite the Sanger Theater, we'll fill up Milton, we'll fill up Fairfield, and Baptist Hospital, our newest location, one of our newest locations. So we got plenty of appointments, should have about 280 available, and the sooner we fill them, the better.
And it's a first come, first served sort of deal. So call in if you're wondering, hey, do I qualify? Hey, you know, what does it entail? Certainly call an office. Basically what we do is we take down your information, your name, a phone number, and then we have someone dedicated at each office to kind of review and then give you a call back and make sure you qualify and get you scheduled on that day. It's not something you can just show up the day of and walk in. We want to get you on the schedule, get you a certain time. That way everything flows smooth on that Friday.
This is for people who have fallen through the cracks for various reasons. You know, 56% of bankruptcies in this country are due to medical reasons. So they've lost their house, lost most of their assets. And if you don't have insurance or you're one of those unfortunate individuals, you are a prime target of this program. And we'll be glad to see you.
Right, yeah. And so most of the patients are ones, like you said, that don't have any vision or medical insurance. But call us. There are some that we see that have maybe some insurance, but it's a plan that doesn't pay for glasses or frames or something like that. So still give us a call, give us a chance to review it, and we certainly, you know, want to try to get you in if we can do that.
Yes. The other thing is we're not a corporate establishment. You're not going to fill out 50 pages of paper and be scrutinized and done all this. We take you at your word. And we get a few cons in every year. I would say 2 to 3%, but you know, it's worth that, and hopefully they'll learn something from it, because those that are that way generally feel ashamed when they see the kind of people that come in that need this and they're taking those slots. So maybe it's good in that aspect too.
So certainly go to our website, TerrezzaOptical.com. It has all the offices listed there, all the locations, all the phone numbers. If you know the one that's closest to you, you can certainly call that specific office. But, you know, even if you don't know, you know, which one's closest to us, call one, and then we can decipher from there, you know, what might be the closest office to get you seen.
One other big point is you are fit with the same thing everybody else gets. There aren't some crummy $2 frames there like you pick up in the readers at Dollar Tree, to give them a plug. These are the same stuff we fit everybody else with, and the same lenses. So you'll get grade A stuff and you'll look nice, and you'll be proud of them.
Yep. And if you're coming in for that Friday, February the 13th, bring in, you know, if you have a pair of glasses or something that was prescribed to you, whatever the condition is. I always say the more information, the better. Sometimes I like to see kind of what you've been wearing, or, you know, it's not going to certainly make the measurements wrong the day of. I just like to have all that information to see how much of a change is, or hey, what were you doing versus what we're getting today. All that is valuable information to kind of see where we're at.
And bring your medications in too, or your eye drops, or what you've been using, all kinds of stuff. The more you bring, the better.
I know when I first started with you, that was one of the things, and it's been, you know, certainly one of those great things where we have patients that, you know, hey, anything can happen to all of us. You know, we could all be, you know, one medical emergency or one job being cut or fired from being to where, hey, we need some help, and we certainly want to help these individuals, these patients, to get them the proper eye care, because heck, if you can't see, I mean, if you're trying to find a job, you're trying to do this, you're trying to do that,
you're done.
I mean, that's a big part of it. So
5 to 10% of them manage to get on their feet, and they become patients for life too. So we're proud of that one too.
Yeah, that's, and definitely I've seen a number of patients that we saw, you know, years and years ago for this program, and like you said, they've got medical insurance, they've got vision insurance or something now, and we're still seeing them, and things have changed in a more positive way for whatever the reason, and they've stayed with us, which we'd love to see. Anything else that we want to add? I was trying to think. We said the days. We certainly said to call. There's really no deadline. What we do, certainly once the offices are filled up, and they're certainly not filled up now, but so call if you think you want to do it. Don't wait to, you know, February the 10th through the 12th. Go ahead and call now, because once we fill up the schedules, and there's a lot of appointments, there's a lot of slots available, but a couple days before, a week before, we may be filled up and may not be able to get you in this year. So the moral is just if you're interested, and you know, whether you qualify or not, give us a call. Let's go through it and certainly try to get you in to one of the offices and let a provider see you. Whether it's, hey, you need to see better with glasses. Maybe it's a medical condition that you've been putting off. Maybe it's, hey, I can't see out of my left eye, or I was told I had a stroke, or I had an abrasion, or any of that stuff we're going to see that day and try to take care of you.
That's correct. Primary care, full scope.
Well, the other thing I was going to talk to you about, since we got a little time here, is Palafox downtown, the renovations on Palafox. I wanted all the patients to know, certainly that office is still open. We're not closed at all. In fact, for the most part, it shouldn't really affect the patients we see, because most of them are parking behind the office anyway, or coming down the sidewalk area. So I wanted you to talk about the renovations and let them know that certainly our office at Palafox has not been affected and will not be closed for any length of time during the process.
That's correct.
Yeah.
You can come down Balin and go south on Balin and pull in behind my office. I pay for your parking. There's a 60-car parking lot there that I have leased, the largest in downtown. And you just come in, you give your license plate number, and I pay for your parking, and that goes away. And as far as the front end goes, this is one of the best things. This is my third renovation in downtown Pensacola, and this one's a Lulu. And if any of you have traveled to Savannah or Charleston, the average retail on that went up, whatever their business was, the average increase was 27%. So there's a lot of mom and pops on Palafox, and that's a good thing. And downtown is strong, and when this gets done, we'll be serious. So I'm very positive about that, and anything that you hear otherwise is short-sighted, not to use a technical term, right?
Well, I think, I guess it's not the private lots, but the public lots. I know parking-wise, there's a lot of free areas I think that they're offering. I was down there parking the other evening, and a lot of them were free because of the renovations.
That's
just
right,
around
too.
them. So
Yeah.
they're not having to pay like they normally would while all this is going on.
Yeah, if you want to park in the free one, you save me some money, I'm good with that.
So, I guess public versus private lots and that
Yeah.
sort of thing. But, I just didn't want that to affect, or anybody to think just, hey, if you're driving by there, that we're not open or anything like that.
If anything, we just finished construction yesterday on 2 more rooms in the downtown office. So you have plenty of room. We have 3 doctors there to see you on an emergent walk-in or whatever you need if necessary. But you may have to wait because these things can't be scheduled with an appointment, but we're still glad to see you.
I know what we're trying to do. Certainly, I'm glad we're busier, but we hate it when patients are booked out for a full exam, more than a couple weeks. And so we've tried at all of our offices to, I know Milton was expanded a few years back, Palafox expansion. I know Fairfield, we just put 2 more exam rooms. And so we're trying to make it where we can accommodate and see patients and not have that wait time that, where they have to wait 3 or 4 weeks or 6 weeks or whatever to be seen. And we've had a lot of providers, certainly. We went from 3 providers when we first started to how many providers do we have now?
We have 14.
Yeah. So that's a good thing. And I think that makes us where, we're diversified, where we have certain providers who, are more interested maybe in specialty contact lenses. Some are more interested in glaucoma, ocular disease, dry eyes. And so I think that makes us good where we all do routine exams, but maybe you need to be seen for something specific. And the chances with us having that many optometrists is there is one in our group that, hey, they do a lot of myopia regression, they do glaucoma, they do diabetic retinopathy, they do plaquenil, they do thyroid, we do a lot of things.
They do. And they our latest doc does this myopia regression where your prescription kids can get this treatment and not develop prescriptions into big, thick Coke bottles. And that's very popular, and she's certified in that, and we're ready to go. And we have all the latest equipment in that.
Well, I know you started with pediatrics, and certainly that's. I guess my question to you would be, what do you tell parents who say, when should I bring my kid in for their first exam? Mm-hmm. How old should they be? Should I be worried? What do you really tell them as far as age-wise or what to be looking for? When should they come in for that first full exam with you?
Exactly. Ideally, we want to see your kids before age 1 or right around age 1 there. That's the recommendation. And I have a lot of people not want to bring their kids in because they can't tell us what they see. They can't read the eye chart. They don't understand how we're going to do things. But with children, it's quite simple. medical, you know. We'll dilate their eyes, make sure that the health of the eyes looks good. And then we have techniques where we can figure out if they need glasses right off the bat. And mainly the children that we're targeting at this young age is going to be children at risk for developing a lazy eye, or an eye that doesn't see as well, or an eye that turns inward or outward. These are issues that will cause developmental problems for their vision system. So we want to catch those real early, because we'll have a lot more availability of treatments to give them to help them. When we catch it later on, it's much more difficult. And then ideally, we'd see them every year or two. And then if you miss that, definitely before school. We don't want your kids doing poorly in school because they can't see the teacher, or they can't see well enough to pay attention and hold still in class. So we definitely want to get them in there. Different optometrists see different kids at different ages. I've seen 1-week-olds on up. So I'm comfortable doing all ages there, and happy to work back with your pediatricians to make everything flow well for them.
Well, certainly if there's any concerns, they need to be in this, because the kids sometimes won't tell you. I mean, they won't tell you, and they don't have a comparison. So if you ask them, say, hey, how are you doing? They say fine, but they really don't know. They don't cover one eye, and something may be masked. Maybe they see good far away, but they have a tough time seeing up close, or like you said, maybe they have a slight eye turn. So certainly bring them in for that full exam. Maybe they do see good, but certainly the chances are we want to make sure and catch things early so the outcomes are a little bit better.
Exactly right, because if one eye's working well and the other one's not, it's real hard for mom to pick up on that.
Well, thank you for joining us today. Certainly we went into Doctors with a Heart. Give us a call if you want to take part of that program.
Or if you know somebody that could use it.
Yep, just pass it on. Yeah, tell them to give us a call. And it doesn't have to be, and I don't know why I said this, but certainly it doesn't have to be a prior patient. It could be anybody that just needs to come in for an exam or needs glasses or something like that. You give us a call. Or if you're not with a Doctors with a Heart, hey, it's the new year, and maybe you've got new insurance, or maybe you just need an exam, or you need to be checked out. Give us a call. Now's the time to get you in, get you scheduled, get you seen. And we appreciate you guys listening and viewing. We thank Dr. Montgomery for joining us.
Thank you.
And stay tuned to our next podcast. And if you're looking for any topic in particular, you can go to our website. All of our podcasts are on there as far as TerrezzaOptical.com. If you're looking for a specific topic or information on something that specifically, you can Google it or look there. But we thank you guys. Thank you.